Hello, and thank you for contacting Wave. I see from your request that you have a little bit of edge lift, nasal and temporal on both lenses, as well as your difficulty with some blurred vision. If we look at your right lens, we talk about uneven edge lift, for example, 3 and 9 o'clock edge lift, that suggests you might have a little bit more of a toric sclera, and so there's a couple ways to address that. If the fit is relatively good overall, you could just tighten down or lower the edge lift by bringing down the black dot. That'll bring that edge angle, it'll change the edge angle so you won't have as much lift. You could try to go a little bit larger. I understand the left lens, which is a larger lens, has a little bit less standoff, so that's one concept. Go a little bit larger, bring the black dot down, and then also in some cases you can try adding freeform. If you just click on the freeform, that'll extend a little bit of the corneal astigmatism, difference in the meridians, out onto the sclera. Keep in mind when you're fitting these lenses, we don't have any topographical data out there on the sclera, so basically you have to rely on your clinical impression and then make subtle changes in the design accordingly. So one of the easiest ways to bring down the edge lift is to go larger, as you did in the left lens. You can bring down the edge angle, and in some cases, as I mentioned, trying freeform gives you a little bit of more control. You can also sometimes, if you are in freeform, click over to 50% and try to adjust that edge lift just on the nasal and temporal meridians. Remember, if you're in freeform, you have to click on both the 3 o'clock and the 9 o'clock radial to make those adjustments. That's probably what I would do to make some improvement in this lens. As far as the vision goes, keep in mind this is a center near multifocal, and just as it's difficult to get decent clarity out of a center near bifocal, just like your typical soft lenses like Air Optics multifocal, you do end up sacrificing some vision. So what I would probably do is, once you have the fit down, if you're concerned about trying to get that vision clearer, I would consider reducing the size of that multifocal to see if that helps clear up the vision, and also especially for the distance vision, and also if you can show a notable improvement with the over-refraction, include the over-refraction in your final design. Well, hopefully those tips will help you get back on track. Thank you for contacting Wave, and have a great day.